My name is Yadira. I'm an undocumented student. I'm a Latina woman, and I'm a first-generation UCLA graduate. I'm also an aspiring healthcare professional, a physician. I also serve as an internal SoCal president of MiMentor, a national mentoring community where we create opportunities for pre-health students who are committed to serving in underserved areas. DACA means to me an open doors. Because of DACA, I've been able to get a valid work permit, a valid social security number, a valid driver's license. Through this, I'm currently a medical scribe at a South Central Family Health Center, a community clinic where I get to be part in patient care and be part of a team who delivers comprehensive care to vulnerable populations like Latinos and African Americans. I'm also an educator. As an educator, I impact the lives of high school students and college students, to make sure that they have the resources and the support they need to succeed and to, gain their college graduate degree. MiMentor supports legislation like DACA because it stands with the mission of making sure that pre-health students have all the resources they need to succeed in their aspiring healthcare profession. So personally, MiMentor has been a key to gain access to different resources and areas where I could expand on my leadership skills and when I could give back to community members. For instance, we've created community forums like Together We Lead, where we talk about issues like social justice and lack of mental health and lack of comprehensive care. And when our community members and people who attend these events leave with actionable solutions, like understanding their own privilege and using this to uplift our communities. So one of the major healthcare effects of rescinding DACA is decreasing the culturally competent physician workforce that is committed to serving in vulnerable populations like South Los Angeles. So without DACA, this means that these undocumented students, like myself, we can't finish our medical residency. We can't exercise our passion and our want to come back to the same communities we come from, who desperately need bilingual doctors, bicultural doctors, doctors who have the knowledge of what it means to grow up without healthcare access and lack of primary care. So by rescinding DACA, then you're directly affecting these communities who want, and who need, doctors who know how to serve them well and addressing the healthcare disparities that continue to be exacerbated in these communities.
My name is Brian, and I'm the internal president for the Northern California region of MiMentor. An ally is someone who uses their privilege, uses their resources, takes action, and stands in solidarity for groups that are threatened. The importance of being an ally for undocumented students is that you have the power to create change, support legislation, and advocate for this community. So as an ally, I currently support legislation. I support in marches. I support by making calls to Congress. These are some of the actions that you can make to support the undocumented community. If you have the power to be an ally, I encourage you to do so. Stand with the undocumented community, help them share their stories, help them come out of the shadows, and support legislation that will help this community thrive.
I think that in order to really help, you have to kind of get educated on the rules and find out what's really going on, what it means to have DACA and what it means to have DACA repealed before you could really help, and then just let people know that they can come and talk to you or you can have your resources available to help. I am an ally of undocumented youth, and I am a daughter of undocumented immigrant. I'm a mentor and a doctor, so some undocumented youth that I deal with, they're my patients, and others are my mentees hoping to get into medical school or stay in medical school or get a job in residency training.
So last message is continue to create spaces where undocumented students feel safe to come to you and share the story. Also, if you're in a position of power, continue to support legislation like DACA and that addresses the health disparities and the social determinants of health that continue to affect these undocumented students and stand as a barrier for them.